Hello students, myself Dr. Anagha Marawar and I'll be teaching you today about absorption. Now as you must have finished with your route of administration of general pharmacology, the second part of general pharmacology deals with pharmacokinetics. Now what is pharmacokinetics? The definition of pharmacokinetics is the study of drug movement in our body. Actually, in general pharmacology, you will be dealing with two types of pharmacos, that is pharmacokinetics and pharmacodynamics. So today we'll be dealing with one part of pharmacokinetics, that is absorption. So you need to understand what is pharmacokinetics. Okay, so in Greek language, pharmakon means drug and kinesis means movements. So you can also say pharmacokinetics means what the body does to the drug. Or in other terms, you can also say what happens to the drug molecule after it has been administered to the subject. I hope you're clear through it. Now, there are different processes in pharmacokinetics. Now, what are those processes? There are four processes, that is A, D, M, E. A for absorption, D for distribution, M for metabolism and E for elimination. That is A, D, M, E. And today we are going to learn about the first part, that is absorption. Before understanding absorption, you need to understand how these drugs get transferred across membranes. What membranes? That is cell membrane. Now, you must have studied in your first year that cell membrane is nothing but a bilayer of lipids with the hydrophilic heads oriented outwards and hydrophobic hydrocarbon chains oriented inwards. Okay, so you can see the orange ones, orange molecules of lipids. Those are oriented outwards. These are hydrophilic ones. Okay, and the thing inside those orange molecules or lipid bilayer is the hydrophobic one. So transfer of drug across membranes depends on different membranes having different characteristics. They also depend on the pore size and pore distribution, which is not uniform throughout the body. So transfer across the cell membrane is different in different tissues. It is different in livers, it is different in brain, it is different in uterus or different organs. For example, renal tubules, placental transfer. So about the placental transfer, you must be knowing that there is a placental barrier. So only lipid soluble non-ionized drugs can readily cross the placental barrier. Whereas polar compounds, that is substances with high molecular weight, for example insulin, dextran, they cannot cross the placental barrier. Okay, now here comes the terminology non-ionized. So the drugs can either be ionized or non-ionized depending on their pH and the pH of the medium which they are dissolved in or they are present in. So if the drug is in its non-ionized form or unionized form, we can also say that they are lipid soluble, and if the drug are in ionized form, they are lipid insoluble. This is very important to know. So I'll again repeat, the non-ionized drugs are lipid soluble and ionized ones are lipid insoluble. Another example of cell membranes is the blood-brain barrier. Okay, so in blood-brain barrier, the intercellular junctions between the endothelial cells are very tight. So, water soluble polar materials do not penetrate the brain tissue, and lipid soluble non ionized form. As I've already told you, that non ionized form of drugs are lipid soluble. They penetrate more easily. For example, ether, halothane. These are the general anesthetics or centrally acting drugs. But in certain conditions like inflammatory ones, which causes cerebral meningitis, viral infection, they alter the permeability characteristic of blood-brain barrier. And therefore, some drugs like penicillin, chloramphenicol, which otherwise have poor blood-brain barrier permeability, they now show enhanced penetrability. Okay, so in certain specific condition, exceptional conditions, the drugs can transfer across the tight junction too. Now, the major transport mechanism by which the drug get transferred across these cell membranes are passive diffusion, carrier mediated transport, which are again of two types, that is facilitated diffusion, active transport. The third one is pinocytosis and filtration. So, I will not go into the detail of these ones. We will move ahead with our topic. Now, we will, after understanding what the transfer of drug across the cell membrane is, we will go directly on to our topic, that is absorption. What is absorption? A passage of a drug from its site of administration through biological membranes into the plasma. I'll again repeat, passage of a drug from its site of administration. Okay, site of administration means you have studied different routes of administration. So, by which route, where the drug has been given, what site it has been given through. So, the passage of drug from that particular site into the plasma through biological membranes is called absorption. So, it is important for all routes except intravenous, because in intravenous route of administration we directly administer the drug into the veins. So, what are the factors modifying absorption? There are certain factors which modify this absorption process. So, these are aqueous solubility, concentration, area of absorbing surface, vascularity or blood flow to the absorption site, and route of administration. We'll see one by one. Aqueous solubility. And the drugs given in solid form, for example in tablet, capsules, so they must dissolve in the aqueous biophase. Whatever the biophase is, it can be a plasma, it can be mucus, it can be gastric acid. Okay, so whatever the media they are in, they have to get dissolved in that particular biophase before they are absorbed. So what do you think? More the solubility, more is the absorption. Okay, so that's why in route of administration, in oral route, you must have studied that if the liquid preparations are given, they are readily absorbed because they need not to dissolve into the biophase. They are actually in the liquid form. Okay, and the tablets or capsules which are easily disintegratable, they get dissolved faster in this media and they get readily absorbed. The second factor is concentration. Drug given as concentrated solution is absorbed faster as compared to the dilute solution. Isn't it obvious? Concentrated solution gives you high percentage of that particular drug to that particular site. So from that site, the drug gets absorbed into the blood plasma where the drug is 0%. So from 100% to 0% there will be transfer. And if the drug is given in dilute form, or after the drug is given, we ingest food which will dilute the presence of food to the site or to the into the stomach, there will be less absorption of that particular drug. Third point is area of absorbing surface. More the area, that is larger the area, faster is the absorption. So to give you the simple example, again you must have studied in physiology. So if the drug is given and it goes into the small intestine, what is the area of small intestine? It is very large as compared to large intestine and stomach, right? And adding into that, the small intestine, the inner layer of small intestine is made up of large villi, which increases its surface area. So through this large surface area, more cells will be available for the drugs to get absorbed into the plasma or into the blood. So more the surface area, faster is the absorption. Fourth point is vascularity or blood flow to the absorbing surface. So more the blood flow, increase the absorption. If the blood flow is less, where would the drug go? Right? So that's why more the blood flow, more the dilated blood vessel, so more will be the absorption. And the last point in absorption, factors affecting absorption, was route of administration. Okay, so here we'll be dealing with oral, subcutaneous, intramuscular and topical sites. So the drugs given by this particular route, how will they affect the absorption? We will see. Oral route, as I've told you, non-ionized, which are lipid soluble drugs, are readily absorbed from the stomach as well as intestine because they are lipid soluble. Acidic drugs, for example, salicylates. So salicylate, to give you example of salicylate, is aspirin. I am sure that everyone, you must have heard the name of aspirin and few of them must have taken aspirin for headache. So aspirin is a type of salicylate. So this is an acidic drug which are predominantly unionized in acid gastric juice. So acidic drug in acidic medium, they will remain unionized. Simple chemistry, there will not be any ionization. So the drug that is acidic drug in acidic medium will remain unionized. Hence, it is lipid soluble and it's absorbed from the stomach. And the basic drug, for example, morphine. These are largely ionized drug and absorbed only on reaching the duodenum. Here in the duodenum, the media is basic or alkaline, where the basic drug reaching duodenum will remain unionized and again is lipid soluble in the media of duodenum and gets absorbed there. Absorption from the stomach is slower sometimes because the mucosa is thick as compared to the other parts of the intestine. The mucosa of stomach is thicker and it is covered with mucus and the surface area is very, very small again as compared to the small intestine. The second point which we have already discussed, that the surface area of small intestine is much larger due to the presence of villi. Presence of food in the stomach, in intestine, dilutes the drug and will retard its absorption. We have seen that concentration of the drug in the intestine and anywhere will affect its absorption. So more the concentrated drug, more will be the absorption. So if we take food, it will dilute the drug and will retard its absorption. highly ionized drugs. So highly ionized drugs are large molecules and they are lipid insoluble. They are very poorly absorbed when given orally. So such kind of drugs have to be given by parenteral route. Now certain drugs are degraded in gastrointestinal tract with its different enzymes, with the presence of acid. They get degraded. What are those drugs? For example, penicillin G is degraded by acid and insulin is degraded by peptidases, and these are ineffective orally. So again, they have to be given by parenteral route. Another point in oral route which will affect the absorption of the drug is enteric coated tablet. So enteric coated tablets, they have the coating which is very acid resistant. Some of them has sustained release preparations. So these are the drug particles coated with slowly dissolving material. So the coat outside the active drug gets dissolved very slowly, and they can be used to overcome acid lability. We have seen in the previous slide said that some drugs get degraded by the presence of gastric acid. Okay, so to avoid that, we can give such drugs coated with a slowly dissolving material, so they doesn't get degraded in the acidic media, and some drug can also cause gastric irritation. So this also can be avoided, because as the drug is ingested with a coating, so it will pass the gastric media and enters into the small intestine, right? And here it neither gets disintegrated into the acidic media nor it irritates the mucosa of the stomach. So in the small intestine, it will get absorbed into the circulation, and the third advantage it will create is its duration of action. Okay, so these are the factors associated with enteric coated tablets. Few more points related to oral route is absorption of a drug can be affected by other concurrently ingested drugs. Now for example, the patient is on multiple drugs. One drug which will increase the motility of gastrointestinal tract, or the drug which will increase the acidity of the media of the stomach. So obviously that will affect the absorption of the another drug. Okay, other point is this luminal effect, formation of insoluble complexes. For example, tetracycline and iron preparation form an insoluble complex with calcium salts and antacids. So if the patient is on tetracycline, you should avoid giving the patient calcium containing drugs or calcium containing food materials. Otherwise, tetracycline can have a complex with the calcium ions and it becomes unabsorbable. Again, iron preparations are never ever given with calcium preparations. Iron preparations are never ever given once the patient consumes milk immediately after that. It is never given. Another point is alteration of gut flora by antibiotics may disrupt the enterohepatic cycling of oral contraceptives. So the antibiotics are against the bacteria. So there are good bacteria inside our intestines, and antibiotics affect those good bacteria also. So these good bacteria are for enterohepatic circulation. Okay, and this is responsible for certain pharmacokinetic properties. You will be dealing these in the further lectures. Now, as oral route is over, the another routes in factors affecting absorption are subcutaneous and intramuscular. By these routes, the drug is deposited directly into the vicinity of the capillaries. Okay, in subcutaneous and intramuscular, we are directly injecting the drug in the vicinity of the capillaries. Capillaries having large paracellular spaces do not obstruct absorption of even large lipid insoluble molecules or ions. As the capillaries of these area have large intercellular spaces, they do not obstruct the large molecules even. Thus, many drugs not absorbed orally are absorbed by these routes, that is subcutaneous and intramuscular. Here you can see the intercellular pores of usual capillary is more, and there is a tight junction of intercellular pores in the brain capillaries. Okay, so in the brain capillaries, just a revision, only lipid soluble drug or non-polar drug gets absorbed. But in usual capillaries, the lipid insoluble and polar drugs and lipid soluble ones both are absorbed. Absorption from subcutaneous site is slower than that from intramuscular site, but both are generally fast and more consistent, predictable as compared to oral absorption. Now, what happens when the drug given by topical sites? Topical means when the drug is given through skin, cornea, mucous membranes. Okay, skin means any ointment, any solution applied over the skin, and cornea, some eye drops is the most common example. Mucous membrane, any nasal drops, any ear drops is another common example when the drug has to pass through the mucous membrane. So, systemic absorption after topical application to these sites depends primarily on the lipid solubility of the drug. As we have seen, the drug has to cross the lipid bilayer of the membrane. So, it has to be lipid soluble. So, absorption can be promoted by rubbing the drug incorporated in an oleaginous base. So, if the drug is not lipid soluble, we can make it lipid soluble by mixing it in oleaginous base or by use of occlusive dressing, which increases hydration of the skin. So, more the skin is hydrated, more will be the absorption. More is the oleaginous base of the drug, more will be the absorption. Cornea is permeable to lipid soluble unionized drugs. So, all the eye drops, it contains lipid soluble unionized form of drug. But certain drugs, that is timolol eye drops, which is a drug which get absorbed into the systemic circulation, it has effect on heart and produces bradycardia, and it also has effect on bronchus or bronchial smooth muscle and causes its constriction, and it can precipitate asthma. So, now if you are clear with absorption, we will be dealing with the most important part of this part, that is bioavailability. So, what is bioavailability? The rate and extent to which the drug is absorbed and becomes available to the site of action. Okay, I'll again repeat. It is rate and extent to which the drug is absorbed and reaches the systemic circulation in its unchanged form. The one which you are seeing onto the slide is not the definition. Okay, the absolute definition is given in the textbook. You should refer the textbook for the proper definition. I am just explaining the term bioavailability. It is a rate and extent to which the drug is absorbed and reaches the systemic circulation in its unchanged form. So there are many factors which affect bioavailability of an orally administered drug. So now we'll be dealing with factors which affect bioavailability. Okay, now on this particular topic, beforehand only I want to tell you that on this particular topic there can come a long answer question. So the format of the question can be define bioavailability and describe different factors which can affect this particular bioavailability. Okay, so many factors we have studied up till now are common to bioavailability also. Okay, so we'll go through them one by one. The first factor is lipid solubility. So I have explained you that the drug, if it is lipid soluble, it can cross the cell membrane and reaches the circulation. If it is lipid insoluble, it will not cross the cell membrane and will not reach the systemic circulation. Again, I have told you that if the drug is unionized, then the drug is lipid soluble. So only unionized form of drugs get absorbed completely, or more of that drug gets absorbed into the circulation. Okay, so the drug here, it is given that it has got low lipid solubility, gets poorly absorbed. The example given is streptomycin, which is an antibiotic. Now the second factor which affect bioavailability is particle size or the formulation of the drug which are given, which you are giving by oral route. Now the larger particle size decreases its bioavailability. Okay, for example, in a cup of milk, if you want to dissolve sugar, so there are fine particles of sugar, coarse particle of sugar. So if you use coarse particle, it will need more times to get dissolved into the milk. And if it is finer one, or if it is in the powder form, it will get dissolved quickly. So same as with the drug. More the size of the particle, drug particle, it will need more time for the drug to get dissolved in that particular media and further its absorption. So it decreases the bioavailability. Example here given is griseofulmin. It is an antifungal agent. The third point in factors is disintegration time and dissolution time. Okay, disintegration, the name itself suggests that it is the time required for the particular drug particle to get disintegrated. Disintegrated means converted into short or small particles. Okay, and then if these small particles get dissolved into that particular media, this is called dissolution. So more the disintegration time and dissolution time, lesser will be the bioavailability. Lesser is the disintegration time and dissolution time, more will be the bioavailability. Next factor affecting bioavailability is ionization. This we have very well discussed. Next point is food. Food decreases absorption of tetracycline, penicillins, etc. as food dilutes these drug particles. Okay. And the next point is GI motility. Decreased motility, for example, which happens in diabetic neuropathy, it slows the drug absorptions. And in increasing, if we can increase the motility or can happen in diarrhea, this also can impair absorption. So very slow motility and very fast motility, both factors are not good for bioavailability of any drug. Another factor, blood flow. As we have discussed in the blood flow factor of absorption, here comes the same. More is the splanchnic flow, that is a blood supply to the intestines. More will be the absorption of the drug. Another term is first pass effect. Now this term you will be dealing with in metabolism. Okay, I'll just maybe tell you in short that it is the metabolism of the drug in the liver or gut wall before they reach the systemic circulation. So any drug given by oral route, it gets metabolized in the gut wall or it gets transported to liver, it gets metabolized there too, and then the rest of the drug reaches the circulation. This is called first pass effect. So many of the drugs which are given by oral route undergo this first pass metabolism and very minimum quantity of the drug reaches the blood circulation. The example of such drugs are propranolol and morphine. Next factor affecting bioavailability is drug interaction. We have studied that calcium, when it is given with tetracycline, it forms a insoluble complex. Or iron, if you can see in the market, iron is usually combined with vitamin C in the preparation itself, or a separate vitamin C tablet is given along with iron preparation to increase its absorption. Okay. Next factor is surface area. This also we have studied, that is larger the surface area, more will be the absorption. And the last point is disease condition. So the diseases like malabsorption, here the mucosa of the intestine is affected. Okay, and this will affect the absorption of the drug, or this will hamper the absorption of any drug which we are giving by oral route. And the other disease is cirrhosis. There are many diseases which affect the absorption of the drug when it is given by oral route. So cirrhosis is the whether liver is damaged. Okay, so there is no metabolism and the processes are not happening in the liver, and there is no active metabolite in the blood is reaching into the circulation. So these were the factors affecting bioavailability, and this is the question that commonly comes into your examination, and this you should be thorough with. Okay, so go through your textbook, read the chapter nicely to understand what I have just discussed with you. So to summarize, we studied what is pharmacokinetics, the definition, what do you understand by pharmacokinetics, the 4 processes which are the part of pharmacokinetics. Then the second thing we had studied is transport across the cell membranes. Third, absorption, different factors affecting absorption. Next, we had studied bioavailability and the factors affecting bioavailability. I hope you have understood the topic well and you will read the topic. Thank you so much.